So I'd like to introduce Michael Fletcher, who is an economic consultant. He's an independent analyst who's worked as a public policy analyst and economic researcher for over 25 years, mostly on social policy, labour market and immigration issues. He's the co-author of a book titled A Fair Go for All Children, Actions to Address Child Poverty in New Zealand, which was published by the Children's Commission and Barnardo's in August 2008. And last year he worked for the Treasury on a report relating to sickness and invalids benefit receipt, and I think that's the basis of his talk to us today. That's another excellent paper that I'd recommend you take a look at. So please welcome Michael Fletcher.
Shout rather than just wave. I've got my watch. I promise I'll try and stick to the 10-minute time. As Catherine said, this was some work that I did for the Treasury late last year, and they were asking me really to look at two things: the reasons for the long-run growth in sickness and invalids benefit, and then what might be done to improve outcomes. Oh, sorry. Is that one okay? So just to start with, you've seen a version of this graph from Monique's presentation at the beginning of the conference, which was how we compare to the rest of the world. The graph that the bar she was showing was the lower of those two dark ones, which is where they rank New Zealand. But they have got for comparability reasons, they actually have a slightly odd measure. They exclude sickness beneficiaries who've been on benefit for under 2 years, and they exclude ACC recipients. If you add both of those groups in, we're pretty much near the average. We're not up near the top end at all, and they're countries that mostly have a dual insurance-based system and a flat rate, and that puts up the numbers dramatically. But we are somewhere near the middle. And this is a graph that I really want to focus on, and Bob Gregory gave a version of it for Australia, and Paul Rodway used it yesterday as well. What it is from 1940 through to 2008, 2009, showing the different types of benefit, numbers on the different types of benefits as a percentage of those aged 15 to 64, the working age population. And it's quite remarkable. The dark line is sickness and invalids benefit together, and you can see that very, very long spell from the end of the Second World War through to the beginning of the 1980s, when we had just an absolute flat line. 1% of the working age population was on either of those two benefits. And then for the next 35 years, it's just gone up and up and up and up, and kept on going up. The orangey coloured line is the invalids benefit, and you can see that one started to rise earlier, and it has just gone in a straight line up, whereas the green sickness benefit didn't actually rise till a bit later, and has then wavered around a bit. The blue line at the top is the unemployment benefit numbers, and you can see that went way up in the late 1980s, early 1990s, bounced around a bit, and has come down equally steeply before the most recent increase for the global financial crisis. The sickness benefit numbers seems to show some sort of lagged relationship with the unemployment numbers. The invalids benefit doesn't at all. And I'll come back to that graph because I think it's at the heart of the problem in terms of numbers. So the first thing I did with the paper was see whether it was possible to work out how much you could explain by health factors or demographic factors or policy factors outside of the benefit system and labour market policy. And overall, I couldn't put a figure on it, but overall you can get to a pretty safe conclusion that it accounts for some, but really is not the main driver of what's going on. So some of the things that you can see is overall the population health has not got worse, but there has been some increase, or probably increase, in the recognition of mental health problems that has contributed to an increase. Population ageing certainly had some effect. A reduction in partnering rates might have had a slight effect. Deinstitutionalisation certainly had some effect, although again not huge in numerical terms. And of course the increase in superannuation during the period when it went up from 60 to 65 did add to, in particular, invalids' benefit. Interestingly, the ACC work capacity testing, which came in the late 1990s, appears to have had only a small impact. I'm going to have to hurry. So coming back to the labour market story, there seems to me to be two key elements of it. The first was that very, very rapid increase in unemployment, that major labour market shock that we had from the late 1980s through to the 1990s. And that certainly appears to have had a significant impact. The way that I found it useful to think about that was this model that Beattie et al. Set out for the UK. It's a very stylised model, but it does help explain it, and I won't go through it in detail, but the key factors of it is it requires no assumption about worsening health status in the population and no assumption about benefit fraud or miscategorisation at all, but you can still achieve, as a result of a labour market shock, a semi-permanent long-term rise in sickness and invalids benefit numbers. And what happens is there's a shock to the employment section in the top bar there. A whole lot of people with health problems lose their jobs. Some go onto the sickness benefit, some onto UB. Unemployment numbers move up higher and more people shift from one benefit to another. When unemployment starts to improve, when employment starts to improve, it's the unemployment beneficiaries who move off benefit, leaving behind the incapacity benefit group.